Yeah, hi. My name is Louis Jones. I'm a member of Users United. We're a network membership organization of former and current drug users committed to community health, safety, and social justice. We're here at the DPA conference to listen, to learn, to network, to strategize, to collaborate with other users, former and current, but the lead users who are stigmatized, criminalized, marginalized. We find that, and I find it interesting that through the Obamacare, that the substance use disorder addicts, which we don't use, users are now medically health care. That they get health care like diabetes, like any chronic condition, which means that it's not going to be punitive, which is what we're about and strategizing about, that it not be punitive to the cure, but it be providers for the care, and that it is the public health issue that it is. No more punishment, because we know that the war on drugs, which is the longest war in history, is about mass incarceration, race, prisons, prisoners, people locked up, locked out of healthcare, housing, education, employment, locked into poverty, recycled back into prison. Big business, big money, no solutions. But the solution is through this healthcare, Obamacare, Affordable Care Act, right? We have a good possibility under this substance use disorder as a chronic condition to get covered, first of all. More people have access, not to treatment courts, to primary care, right? So it's not the treatment courts, but primary care, where from primary care, people get the type of treatment that they need if they want treatment, or harm reduction oriented primary care. Harm reduction is included in that as well. Clean syringes, which saves lives. Overdose prevention, which we as a users union are user to user, street based, right? In terms of users being trained to give out clean syringes, right? And also to risk arrest, how to reduce the risk of arrest when confronted by police. Given that in New York we have a victory in regards to the profile bill and the expansion for complaint when it's not a probable cause but we've been profiled on the jump out with a stop and frisk, that we can bring to the independent monitor, which gives our constitutional rights as citizens doing community health in the neighborhood, which decriminalizes us. Well, what criminals do community health? I'm not a criminal. If I'm a person who has a history of use or a user, and I'm out bringing health care to my community to prevent the spread of HIV and hepatitis C and education and information, right? Then I'm doing a service, a public service, a public interest to my community. And these are people that are stigmatized otherwise, right? So we got that working with overdose prevention, which we help to prevent fatal overdoses. We're sponsoring from the Harm Reduction Coalition, our allies from Drug Policy Alliance, our allies from other users union organizations like the Urban Survivors Union and other unions, Vocal, and many other San Francisco Drug Users Union. There's a movement to end the new Jim Crow, the racist prison system, where 85% of us are people of color, Latin, and black. Where over 700,000 of us have been locked up in 2011. Low-level, non-violent, drug offenses have been incarcerated. Drugs don't get arrested, people get arrested, right? Families are devastated. Children are put into the system. Communities are devastated and destroyed. We're about empowering individuals, right? Strengthening individuals, to strengthen our community. That's what we're about. And there's a grassroots bottom-up work that we are committed to. If it's one by one, with our unity, and purpose and cause, we see change. Change is coming. We're in the process of change. We're living in the solution. This is really not no wishful thinking. It is actually happening. We're witnessing groups like LEAD, and law enforcement, assisted diversion. I mean, we're learning about those possibilities. There are another way other than incarceration, where we have 2-point-some million people, more than any other country of the land and free, locked up. Only because they make a choice, a consensual adult, a choice to put into their body or use their body, as well as pros, prostitutes, pro-sex workers, and users who are stigmatized, right? To make money. We're not a commodity. I'm not a commodity because I'm a black guy that lives in a neighborhood, right? I'm an easy pickings for some quota and some type of law enforcement. But we know there's police who want the right thing too. They want to be accountable too to the community, because for them to do good police work, they need the community, right? And we need the community healthy. So we're about public health and safety, all right? And about preventing overdose. And we're going to use the people themselves that are impacted by this to survive, and more than survive, thrive and live a quality of life, and work out the diversity in terms of those who have and those who have done. And so we're being very empowered as individuals and strengthening our communities coming out of this conference. And I thank you, Shiloh, for the interview, man. You're a beautiful brother. Peace.